All right, so good afternoon, everyone, and thank you for joining in on today's speaker series event. As a reminder, this event is being recorded, and as an attendee, you are on mute. But if you have any questions for our guest today, please submit them into the Q&A panel down below. Without further ado, let me introduce our guest for today, Dr. Jason Karlawish. Jason Karlawish is a physician and a writer. He researches and writes about issues at the intersections of bioethics, aging, and the neurosciences. He is the author of The Problem of Alzheimer's, How Science, Culture, and Politics Turned a Rare Disease into a Crisis, and What We Can Do About It, and the novel Open Wound, The Tragic Obsession of Dr. William Beaumont, and has written essays for the New York Times, the Washington Post, Forbes, The Hill, and the Philadelphia Inquirer. He is a professor of medicine, medical ethics, and health policy and neurology at the University of Pennsylvania, and co-director of the Penn Memory Center, where he cares for patients, and he also lives in Philadelphia. Welcome and good afternoon, Dr. Jason Karlawish.
Thank you. It's a pleasure to be here. Thank you, Aubrey. Thank you so much. Greetings, everyone. Greetings from my home in Philadelphia, just a few miles from the campus. Recently, this book of mine was published, and I'm here to talk a bit about it. In particular, I want to talk about what made Alzheimer's a crisis, and then pivot to what we can do about it. You can learn more about me in the book at my website, which is just jasonkarlawish.com. I'm also one of those folks on Twitter at Jason Karlawish. Pleasure to be here, and I hope to have some time at the end to talk with you, but you're welcome to drop me little notes and questions through my website or through email, that kind of thing. So let's go back to 1980. The physician and accomplished cancer researcher and educator, Lewis Thomas, was also an accomplished writer, an essayist, and he wrote this one essay called The Problem of Dementia. It would then be published in a collection of his essays. And I'm going to use this essay as a sort of pivotal moment in history when the problem of dementia became recognized, to then pivot to how and what caused the problem of dementia to become the Alzheimer's crisis. I think a key point will be events that I'm going to talk about. While they're grounded in history in the 80s and 90s, I think many of you will recognize recurrent themes that are still present today in contemporary political discourse. So Thomas is a very accomplished cancer researcher and physician. He was the dean at Yale and the head of Memorial Sloan Cancer Center, so quite accomplished. And he wrote this, that special consideration and high priority was needed for one particular disease, not a disease of the month, but a disease of the century, he said. The brain disease that affects increasing numbers of our population because of the increasing population of older people in the society, senility, or it is now termed senile dementia. The major form of the disorder, he wrote, Alzheimer's disease, affects more than 500,000 people over the age of 50, most in their 70s and 80s. It's responsible for most of the beds in the country's nursing homes at a cost exceeding $10 billion now and scheduled to rise to $40 billion or more in the next few years. It is, he wrote, the worst of all diseases, not just for what it does to the patient, but for its devastating effects on families and friends. This cancer physician wrote this in 1979, republished in 1980. And it's fascinating to read this because he's sort of saying now what we're still saying today. There are a lot of people with this disease. It costs a lot of money, and it's not bad just for what it does to the people who have the disease, but for other people, namely their families. The context with which this essay was being written was a key set of events that had occurred just around this time. One of them, in fact, one of the main events that I narrate in the book was this essay. And it was truly an essay, a 1,200-word essay, not a scientific report, but an essay written by this neurologist, Robert Katzman, The Prevalence and Malignancy of Alzheimer's Disease, a Major Killer, published in 1976. And Katzman would lay out over 1,200 words the argument that this thing that had been called senility, an extreme stage of aging, is actually the disease called Alzheimer's disease. And so what had been prior talked about as just an unfortunate extreme stage of debilitating aging actually should be thought of as the result of a disease. That is to say, dementia in an older adult is the result of a disease. And once you frame it as a disease, what you're saying is medicine needs to step in. Medicine needs to diagnose these patients, it needs to treat them, and most importantly, perhaps you could argue, needs to do research on them to improve the diagnosis and improve the treatment. And in fact, perhaps maybe one might even say dare I say, cure the disease. And so here we are in 1980, and things are really kind of getting organized. There's recognition that this thing called senility is a disease, actually caused by Alzheimer's disease. And here you have a prominent cancer researcher saying we need to make this the disease of the century. Fast forward now some 20, 30 years, and this report comes out, a National Alzheimer's Strategic Plan. This was prepared by what was called the Alzheimer's Study Group in about 2009. The Alzheimer's Study Group was inspired by the Iraq Study Group, namely a bipartisan group of prominent American leaders in politics and society, to take on a vexing question. In the case of the Iraq Study Group, it was the seemingly intractable war in Iraq. In the case of the Alzheimer's Study Group, it was the problem of Alzheimer's disease. This is the preamble, the opening paragraph of their report. I'll just simply read a little bit of it to you. The Alzheimer's crisis, like the disease itself, will unfold gradually, making it all too easy to ignore until we have little opportunity to alter its impact. The prospect of an overwhelming hurricane never became real enough to prompt the strengthening of New Orleans levees. The result was $82 billion in damage and almost 2,000 lives lost. Concerns about the subprime lending never became urgent enough to prompt corrective regulatory actions. We're still tallying the cost of this crisis as job losses and bank failures mount. If we fail to address the Alzheimer's crisis now, we face the prospect of losing lives and dollars on a much larger scale. The word crisis would reoccur 24 times in this report. The framing, again, reminiscent of those Thomas essays, enormous economic costs to America. Well, what happened? Because we saw things getting going in the 1980, and yet here we are some 20, 30 years later, and it's being called a crisis akin to the subprime mortgage crisis and the destruction of the city of New Orleans by Hurricane Katrina. And let's talk about that. So back to this essay. This essay, published in 1976, will sort of kind of think a little deeply about what was happening then and the years to follow. In 1976, the first woman was admitted to West Point. You'll come back to that point a bit. Things were changing in America, the values we held. Well, this gentleman is Jerry Stone. Jerry Stone was one of the 7 members of the 7 families, as he called them. Late in the 1970s, people began to say, something is really wrong here with the American healthcare system. My relative has this thing called senility, this thing called dementia, and I can't get a diagnosis. It took me years to get an answer. And even after an answer, I can't find good treatment. And Jerry Stone was one of many who had those stories. He's a unique individual. He was the president and CEO of the Stone Container Corporation. It started by his family as a simple business in Chicago. By the time he took it off, it was growing. By the time he finished it, running the business, it was a Fortune 500 company, and he had made himself independently wealthy. As an independently wealthy, hard-driving CEO, faced with a wife who was developing debilitating cognitive problems, he wasn't going to take no for an answer, and instead he would make her disease, her dementia, her Alzheimer's disease, his mission. And he would become one of the founders of the organization that would come to be known as the Alzheimer's Association. And there's no question, and I narrate in the book, how he really was kind of the sort of George Washington, if you will, bringing together these 7 different families. There were 7 different organizations that had popped up as self-help groups determined to do something about the problem of dementia. And he would be the one that would bring them all together. And also, frankly, have access to his own checkbook and his Rolodex to really bring in the necessary connections and resources to start the organization that would come to be known as the Alzheimer's Association. So here we are in 1980. The group was founded in 1980, and we've got a national self-help organization determined to raise awareness, improve the quality of care, and expand the nation's investment in research on Alzheimer's disease. Their mission on improving quality of care meant creating a national long-term care social insurance program to finally provide the care that patients would need for the many years of progressive disabling cognitive impairments, care to help support them and help support their family members to deliver care. There were others in this story, though, and this was another key person I want to bring forward. So Jerry Stone is widely recognized as the founder of the Alzheimer's Association and celebrated for that. This individual, though, deserves as much, and I would argue even more credit than Jerry Stone. And this is Hilda Pridgeon. Hilda Pridgeon was another one of the 7 families. And Her organization, her self-help group, was put together in the Minnesota area. She lived in Minnesota. Her husband, Al, also had dementia, much like Jerry Stone's spouse, Evie, but they were from very different circumstances. The Phrygians were neither rich nor poor, as she would say, namely they were middle class. And when Al no longer could work, Hilda, the housewife, had to step up and return to school to get the necessary training to try and rise up at the company she worked for, from the secretarial pool into the managerial pool. She would wake up at 4 in the morning to study before her husband got up, and then she would help him get up, and then she would go off to work and take her night classes, all the while raising a teenage son. The other 2 children were off to school. Her story is a story of incredible resilience and rising up against the assumptions that surrounded what was the appropriate way for a woman at that time to live, namely as a housewife. Anyway, she would, together with Jerry Stone and the other families, form this organization called the Alzheimer's Association. Notably, her organization really was the model for the association. What she and her colleagues, all women, put together in Minnesota was the model for what would become adapted into this self-help group known as the association. So things are really taking off now in the 1980s. And it's not just about families finally realizing we need the healthcare system to step up and diagnose and treat and improve research. There are some cultural events occurring. And this graph here that I've created using a Google Ngram tries to capture what I think is one of the most salient cultural events that helped Alzheimer's disease be recognized as a disease. What this graph depicts is time on the x-axis, so 1900, 1920, 1940, et cetera, right up to the year 2000, to the end of the 20th century. And the 2 lines depict the frequency in the English language lexicon of 2 words, the word beneficence and the word autonomy. And what I'd like to draw your attention to is something's happening around 1900. Around 1900, you see the word beneficence sort of sloping down, but then maintaining kind of a steady appearance in the English lexicon. In contrast, around 1900, you see a word has appeared, has begun to become used, and over the course of the 20th century, takes off in arguably linearly, almost exponential way, and that's the word autonomy, the red line. My point is that prior to the 20th century, the idea of respect for autonomy, the idea of giving people, expecting that people have the right to self-determine their lives, simply was not baked into the culture. And one of the reasons why Alzheimer's disease would become recognized as a disease wasn't just because of disabilities like bathing and dressing and grooming, but because early on it was taking away someone's ability to self-determine their life, to be the person they want to be. Not just men like Jerry Stone, white men who owned a company, but even women like Hilda Phrygian, who started out in the secretarial pool and had to claw her way up through the corporate infrastructure. Hilda Phrygian, by the way, has an interesting story from her youth. She was valedictorian of her class in high school, but she wasn't given the valedictorian honor. That honor instead went to the salutatorian, a man, who she was told by the school system was to go off to fight in the Second World War. He was drafted, and the school system felt that that honor best befell him because he was going to go off to fight in the war. This is, of course, deeply ironic because even if she wanted to go fight in World War II, she, of course, couldn't because she was a woman. What's my point? Over the course of the 20th century, major events would happen in developed nations, namely the rise of the idea that each of us, each adult, enjoys our autonomy, our right to determine how we want to live, and we all ought to respect each other's rights. What makes Alzheimer's disease particularly a disease is it takes away a person's ability to self-determine their life. And if you think about Hilda Phrygian and Jerry Stone, it takes away some degree of their ability to self-determine their life because they've been drawn into this role of caregiver, a role that is not well supported. And we'll talk more about that. So Hilda Phrygian would write a bit about her experience as a caregiver and also get some media attention. And here's an article from the Jacksonville Courier some 9 years after the founding of the Alzheimer's Association. Alzheimer's widow reaches out to others. And what this recounts is Hilda Pridgeon's story of struggling to find care for her husband, Al, an indifferent healthcare system that really offered no services and supports in between the largely ineffective doctor visits. And this story would recount Hilda Pridgeon's struggles and her determination to change that through the advocacy of the Alzheimer's Association to create a system of long-term care services and supports in America. And Hilda Pridgeon would eventually have the opportunity to make her case to the United States Senate. What's interesting here is she's an Alzheimer's widow. And remember too, the article I showed you written by the essayist Lewis Thomas. Remember, it's significant not just so much for what Lewis Thomas says, it's significant for what Lewis Thomas doesn't say. There's a word he never uses in his essay. He never talks about the caregiver, he just talks about the family. And here's another historical trend that I think is very important. Again, Google Ngram, and again on the x-axis, time, years of time, and again, frequency of the appearance of a word in the English language. And what I've done here is plotted the appearance of two words in the English lexicon. The first is Alzheimer's disease, and the second is caregiver. And you can see here, right around 1976, the appearance of the essay written by Dr. Katzman, that the word Alzheimer's disease suddenly appears in the lexicon, and it takes off, as you can see. Look what's tailing it by just about 4 or 5 years, the word caregiver. So what's significant on this graph is two messages. Number one, before 1980, roughly, the word caregiver wasn't used in our lexicon. And number two, after 1980, the word appears and takes off, and it's parallel to the takeoff of the idea of Alzheimer's disease, the word Alzheimer's. My point is that this disease, for people with dementia, has been prevalent for centuries, but this particular role created by this dementia, namely the role of the caregiver, is actually a very modern role, the recognition that's distinct from being, if you will, an Alzheimer's widow. So that's some of the cultural backdrop that would transform Alzheimer's disease, senility, into Alzheimer's disease. But so now, what made it a crisis? Remember, Lewis Thomas was raising all these issues, lots of people, very costly, only more, etc. And I showed you, though, the report from some 30 years later, we have a crisis. So what happened? Well, what happened are events that are largely, and I think entirely, told through politics and culture. So this is one example, but I think a salient example of some of the political events. So by the late 1980s, early 1990s, both sides of the aisle in Washington were interested in Alzheimer's. You could gather a busy hearing room with both Republicans and Democrats to attend a hearing dedicated to the topic of Alzheimer's. This is a notable transformation, and I recount in the book the first hearing on Alzheimer's disease was in 1981, and there was one and only one senator in the room. And I recount some of the highlights from the very moving transcript of that hearing. But now, some 10 years later, this hearing about Alzheimer's disease is packed. You've got both sides of the aisle wanting to speak and talking. The first person to speak at that hearing was this individual, Senator Mark Hatfield, Republican of Oregon. And he began the hearing with a story. My father, he said, was a third generation in our family of blacksmithing. And he would go on to recount his father's steady, progressive, and relentless decline into disabling cognitive impairments, ultimately rendering him, as he wrote there, practically nothing, almost a vegetable. Hatfield hushed this hearing room with his story. And this was a significant event because he was probably the first person in Congress to admit that there's Alzheimer's in my family, raising concerns, of course, what if he has a senior moment? And indeed, he would be given an honorary bracelet, a safe return bracelet by the Alzheimer's Association, which he would accidentally lose at an event. A reporter would find it, and the reporter felt they were onto the scoop of the century, namely that Senator Hatfield had Alzheimer's disease. The association had to step in and say, no, that's not the case. So how times have changed now. You can go to a Senate hearing and hear Senator Collins, for example, from Maine, talk about how Alzheimer's is, quote, the family disease. Well, at this hearing, Hilda Pridgeon appeared, and Hilda Pridgeon gave testimony. And here's a line from her testimony. She told the Senate and the House, people are afraid. I'm afraid. They're afraid of what will happen to them if they get this disease. They're even more afraid of how their families will cope.
We cannot yet prevent the terrible emotional cost of Alzheimer's disease, she admitted, but we can and must do something about the financial burden that is impoverishing all but the wealthiest families. She was making and would go on to make a direct plea for Congress to implement a national system of long-term care services and supports through its national social insurance program. Meanwhile, as she's testifying to Congress for this improvement in the system of care in America, advocates for the Alzheimer's Association have fanned out throughout the Capitol to go to the doors, to go to the offices of the senators and representatives. And one of the representatives they would go and visit would be a representative from Texas named Tom DeLay. And a reporter recounts how Congressman DeLay would meet these advocates. They would make their case, and he would tell them how my heart goes out to you. My heart is with you. Your cause is dear. And then they would leave. One of their points that they advocated to him, by the way, was the need for a system of long-term care services and supports. Remember, his heart went out to them, and he felt their pain. Well, after they left, the reporter said, "What about the system of long-term care services and supports that they're advocating for?" And he would, the reporter would recount the following. Though DeLay greeted the volunteers warmly and assured them that their issue was, quote, dear to my heart, he cooled when the talk turned to the need for a federal long-term care program. After the volunteers left his office, DeLay explained, that's where we may break ranks. No one has yet told me how we're going to pay for this. DeLay's remarks were unfolding in the course of a larger political conversation that had beginning around 1980, a conversation inaugurated with the election of Ronald Reagan to the presidency in 1980. Reagan would come into office and serve for 2 terms, and he would take office with an explicit platform dedicated to reducing the size of the federal government, devolving federal programs to the states, and generally regarding most federal programs, with the exception of defense, as large and wasteful. And he would in fact single out Medicare and Medicaid as bloated and wasteful and in need of cutting. In his State of the Union address in 1984, I quote how he would talk about how the years of the 1970s were full of rising problems and failing confidence. The government had grown beyond the consent of the governed. Families were helpless in the face of mounting inflation and the indignity of taxes that reduced reward for hard work, thrift, and risk-taking. All this overlaid by a growing web of rules and regulations. And his administration would set out to reduce rules, regulations, reduce the size of the government, cut taxes, and otherwise argue that the American family needed to solve the American family's problems. He would never talk about Alzheimer's as one of those problems, but this general approach to governing would be one that would leave a family like Hilda Pridgeon's, if you will, struggling in the face of the years-long costs of providing long-term care to a family member. Indeed, the attitude of the administration towards government might be summed up by this remark that Reagan made in the 1986 press conference. The 9 most frightening words in the English language were, I'm from the government and I'm here to help. Again, an attitude that very much emphasized shrinking the size of the federal government and not expanding the government's role in providing an infrastructure of support for the American family. I have quoted Tom DeLay. Tom DeLay is a very interesting character because, of course, Tom DeLay would become the majority whip when this gentleman, Newt Gingrich, would organize the Republican triumph of taking control of the House of Representatives and further implementing a plan of governing, which included core principles of that included absolutely no new taxes. So what's the net outcome of all these events that occurred in the 80s and 90s in American politics? Well, I had the opportunity in researching my book to have access to the minutes of the board of directors of the Alzheimer's Association's meetings. And as I pawed through those minutes, which was a fascinating archival exercise, I found this memo to the board of directors written in January of 1995, presented by Steve McConnell, then the vice president for public policy of the Alzheimer's Association. And McConnell would summarize the situation in DC at the time. He wrote how there's a challenging philosophy that stresses a balanced budget, smaller government, lower taxes, less entitlement spending, a shift from federal to state government, and an emphasis on personal responsibility. This poses new challenges and opportunities for the association.
to educate newly elected officials and leaders about Alzheimer's disease and the association's central issue, research and long-term care, and to develop strategies to advance those issues in a new environment. McConnell is being careful in his wording, but what he's essentially saying is we've got a real challenge here. The government now, the House, and periodically depending on outcomes of Senate races, the Senate, and depending on the presidential races, is being governed by a party that he summarizes there. This is not an environment which is going to allow an expansion of healthcare and long-term care to meet the needs of persons living with dementia. And also, arguably, is going to be skeptical about increasing the budget for research at NIH to discover better treatments. There's one other cultural event that occurs in this time, and that's depicted in these two sort of graphics. On the right is a PSA by the Alzheimer's Association. The association's consistently been very targeted in framing the problem of Alzheimer's as a particular problem of the American woman who struggled to gain her autonomy. I remember, for example, my mother telling me how in 1960 she couldn't get a credit card. Her husband had to give her credit. So the American woman's story is the story of the triumph of autonomy, of trying to finally carve out the ability to self-determine one's life. But against that story of feminism is arguably the story told by the image on the left. That's Phyllis Schlafly, who would pivot from anti-communist activism to anti-feminism. Her earliest campaign was to oppose the Equal Rights Amendment. She, for example, worried that if Equal Rights Amendment passed, that women would not only be in the Army, but would be drafted to serve in combat roles in the Army. And that was one of several reasons why ERA should not be passed. The family values movement, together with the opposition movement on the left, would have the effect of bundling together a whole host of issues such that you couldn't find a common ground on some core issues where arguably people could agree. Issues like how we're going to care for the many disabled Americans with diseases like Alzheimer's disease. But instead what you had was the view that abortion, expanding long-term care services and supports through a social insurance program, all would be bundled together such that favoring one of those meant that you were favoring all of them, or opposing one of them meant you had to oppose all of them. And this would be a climate in which arguably advancement in the political consensus to create a system of long-term care services and supports and general improvement in care would find itself caught in a political logjam. There's one more reason why Alzheimer's disease became a crisis. So I hope to date what you've seen is it got caught up in a maelstrom of political events that weren't about Alzheimer's disease, but had the unintentional consequences of slowing down progress to improve the quality of care for the millions of adults with disabling cognitive impairments and the many more millions of adults trying to take care of them. I don't think Reagan or his colleagues or Tom DeLay ever deliberately wanted to make those families suffer. Tom DeLay said, "Your cause is dear to my heart." But the political positions they took arguably stifled progress towards improving the quality of their care. There's one other event. So in that same article in the National Journal that reported on the visit to Tom DeLay's office, there was an article called "How Many Victims?" of Alzheimer's disease. And the context for this is very important because I quote here from a PSA issued by the Alzheimer's Association. So this is one of their earliest public service announcements to raise awareness about the problem of Alzheimer's. Today, Walter Cronkite said, there are at least 4 million victims of Alzheimer's disease. But for almost every one of those victims, there's another, a husband or wife, a son or daughter, whose entire life changes with the demands of caregiving. Walter Cronkite. So America's most trusted newsman telling Americans the facts. There are about 4 million people with this disease, and for every one of them, there's at least one other person who's struggling with the demands of caregiving. And this was a PSA that the association would air throughout the United States. Right around the same time that PSA comes out is this story in the National Journal, How Many Victims of Alzheimer's? How big is the problem? Well, the numbers are subject to dispute. What this story in the National Journal reports is that 4 million figure was under great dispute. It came from one study, the East Boston study, And many other researchers, respected researchers, disputed the methods used to count the number of people who have Alzheimer's disease. I detail in the book some of those controversies. My point here in this talk is the inability to tell Congress how big is the problem. An article like this in the National Journal that says the numbers are just subject to dispute, that's not the kind of messaging you want to tell Congress, because if you can't say how big the problem is, they're not going to give you money to take care of that problem. And indeed, it got only worse. The General Accounting Office would issue a report, Alzheimer's disease, estimates of the prevalence in the United States, which would argue that the 4 million figure is arguably overly large, and would look at other reports that report on a much lower figure. And the struggle to arrive at an estimate of the prevalence of the disease would haunt the field for a number of years, until finally there was a sort of détente that I talk about in the book. One last thing makes Alzheimer's a crisis, and that's depicted here. You have a living person who ostensibly is all right, and he's just out of it, and I don't want to see him in this light anymore. I prefer to remember him as a vigorous fellow. These are the words quoted in the New York Times by Walter Annenberg, explaining why he no longer wanted to see his friend, Ronald Reagan. Walter Annenberg was the ambassador to the United Kingdom under President Reagan, and as you know, President Reagan would develop dementia caused by Alzheimer's disease. And in this New York Times story about his illness, the reporter interviewed Annenberg, who told you right here, I don't want to see him anymore. I want to stay away from him. And presumably, of course, wanting to stay away from his wife, Nancy, as well. And so both Ronald Reagan and Nancy Reagan were victims of what's known as stigma, distancing, public stigma. Walter Annenberg saying, I don't want to be around him. The image below is the Lou Ruo Institute in Las Vegas, Nevada. This characteristic Frank Gehry style design depicts an institute dedicated to studying the neurosciences and delivering care to the people of Nevada and elsewhere. What's interesting about this institute, built by a family who was wealthy from running the principal liquor distributor in Las Vegas, is its design includes no waiting room. In brief, I describe in the book how Lou Ruo's son felt so awful that his father had to see other people with dementia that he lied to his father about what was wrong, and decided that when he built this institute, there would be no waiting rooms where patients could see other patients, but instead individual tranquility rooms. So through architecture, even endorsing the stigmas that haunt this disease. So why did it become a crisis? I've outlined a variety of political events. I've outlined a variety of cultural events. And of course here, the particular cultural event was stigma. All right, so that's how we got here. And I hope that many of you, as you're listening to this, are seeing recurring themes. For example, in the last election, one of the dominant platforms of the Republican Party was that was the concern of socialism, that if we expand government programs, that's socialism, and implicitly, therefore, or explicitly, is the loss of our liberty and our independence, unjust takings, etc. I'm not arguing whether one side is right or wrong, but I'm saying there's an enduring set of political conversations going on here that remain today. All right, well, how are we going to solve the Alzheimer's crisis? I'd like to devote the remainder of my remarks to that. And in the book, I talk about the story of the development of treatments that target the pathologies that are known to cause Alzheimer's disease, one of those pathologies being amyloid. The take-home point, which I'm going to not develop in any greater detail here, but I chronicle in great detail in the book, is we're seeing progress in this space, but we should not think that we're going to be able to drug our way out of this complicated problem. That is to say, in the 9 months that we went from having no pandemic to having a pandemic, we developed not 1, but 3 highly effective vaccines. In the 40 years of studying Alzheimer's disease, that's not been the case. And I think most researchers agree we should expect some progress in developing effective therapeutics that bend the curve of decline, but the notion that we're going to cease any decline, revert, and otherwise cure is just that, a notion. And other complex diseases of aging, I think, show the same history, such as cardiovascular disease and cancer. So we should see this disease as a druggable disease, but a disease, therefore, that we're going to have to learn how to live with. So how should we do that? Well, how can we live well in the house of Alzheimer's? And I say the house of Alzheimer's because I want to try to emphasize this idea, both for the idea of a house as something we build and make comfortable and dwell in and have to live in, but also that's just it. It's something we build. It's on our hands to create the ways we want to live with talk about, think about what is Alzheimer's disease. And there are things we can do right now, to dwell in the house of Alzheimer's disease. It's an awful disease. It will remain awful like all diseases, but there are things we can do to make it better. Well, one is we need a national network of comprehensive dementia centers. And in the book, I detail why such a network doesn't exist. In brief, it comes down to the lack of a business model to support the disease, and I detail why that's the case. I was able to find one, and I think probably the only not-for-profit in this case, non-university affiliated, non-research-based Alzheimer's Dementia Center in North Carolina, and I document the determined work of Dr. Peggy Knoll to create that center. So we need a national network of comprehensive dementia centers, and I would argue the events of the last year have shown us the possibilities of telemedicine to deliver that care. We need multidisciplinary geriatric surgery teams. Why? Well, quite simply, one of the most common complications of advanced stage dementia is a fall and a hip fracture and delirium. And I chronicle in the book the efforts of scientists to discover better ways to treat older adults who have suffered a fracture and need surgical care, and ways to reduce the risk of developing disabling cognitive impairments. I had the privilege of interviewing and profiling Sharon Inouye, who made great advances in discovering ways to reduce the risk of developing delirium. And I had a fabulous opportunity to talk to the physicians at Highland Hospital, a small and failing hospital in Rochester, New York, who all realized these folks come in with fractures, no one wants to take care of them, and they're falling apart. We can do better, and I chronicle their efforts to do better. So, multidisciplinary geriatric surgery teams and delirium-free hospitals. We can do these things. The research is there. We just have to muster the political and economic will to make these things the norm. We need to recognize the role of the caregiver. We need to acknowledge that these individuals, Hilda Pridgian, Jerry Stone, and others, have legitimate moral standing and need to be recognized. I highlight this very specific bit of legislation, the Caregiver Advise and Record and Enable Act, the CARE Act, which requires hospitals to acknowledge at the time of admission to identify someone's caregiver and make sure that caregiver is educated about the diagnosis and care plan. This can be done tomorrow, and I would argue that the pandemic has shown us that not all visitors in the hospital, not all visitors in long-term care are merely visitors with to bring some entertainment. They're essential caregivers, and we need to acknowledge their role and support them. And finally, I've been talking about it earlier, is we need to recognize the need for a social insurance program for long-term care services supports. Right now, if you're very wealthy, like Jerry Stone, you have all the money you need to provide long-term care. And indeed, Jerry Stone did. Jerry Stone at one point had round-the-clock nurses and aides, a hospital bed, equipment in his home in Chicago. And in contrast, Hilda Pridgian struggled to find a daycare program that would take her husband, begged Medicare to pay for it, but they rejected it as a mere entertainment for him and a vacation for her. That's still really the case now. The statute for Medicare explicitly prohibits paying for what in the statute is called custodial care, a pejorative term to be sure, implying an individual's building in need of a janitor. But the point is that we do not have a system of long-term care services supported by social insurance. Most developed nations do. Germany has one, funded by a payroll tax. Japan has one, etc. We don't. And I think the events I narrated of the politics of the 80s and 90s explain how that rising consensus suddenly fell apart. Well, what else can we do? Now I'd like to tell you a story about one of the many, back when we used to travel, Alzheimer's meetings. This one was the International Alzheimer's meeting in London, right near the O2 Center. And we enjoyed our visits to the O2 Center because we needed those visits, because we were so despondent. Because of that meeting, I remember we had heard yet another set of results of clinical trials that were negative. And the word on everyone's lips at that meeting, I remember, was one and only one word: heterogeneity. Increasing recognition that this is a complicated disease. The more we study it, the more we learn, the more we see many different pathologies at work, not just amyloid and tau, but TDP-43, alpha-synuclein, vascular disease, ubiquitin. It's not to say that we won't make progress with discovering therapies. Just like with cancer, we discover more about the genetics and the biomarkers, we can better understand the druggable and the non-druggable forms and target therapeutics.
Some people now have spectacular responses to those therapeutics. Some are even cured, but people still do die of cancer. And so too, I think with this disease, we should expect that that will be the case. But there are, again, things we can do right now. And that story is told by the story that I recount in the book of Lisa Barnes, a psychologist at Rush University, who's done brilliant work understanding the intersections of brain health, environment, and social and economic access. She's an interesting story because she started out when she wanted to study psychology, studying HM. HM is the classic lesion-based model of brain function. Namely, he had bilateral hippocampal extractions to finally stop disabling seizures. And while his seizures would end, he would lose all memory capacity. She initially felt that that was the way to do psychology until she started to listen to her own life story. She grew up in Chicago in the Hyde Park area, in an integrated neighborhood. She would go to school, though, in Wellesley, in Massachusetts, and decided to take some trips into Boston just to go see the city. In Boston, she would discover what she hadn't grown up with in Hyde Park, Chicago, namely people avoiding her on the T and otherwise showing through gesture and word frank racism. In fact, the experience was so disruptive for her, she would leave Wellesley and ultimately go to a historically Black college down in the Atlanta area. My point is told by this other town further to the west of Wellesley, Framingham. We all know the Framingham study. It's discovered the risk factors for cardiovascular disease. And one of its key insights is an insight that we heard about when we were at the O2 Center at the International Alzheimer's meetings. Namely, it and other large longitudinal studies have shown that over the last 40 years, the risk of developing dementia has been declining. It's been declining. There's still lots of people with dementia because there's so many older adults, but they're not as many as we expected. Why? That takes us back to Lisa's experiences at Wellesley and in Boston and in Atlanta. Education and opportunity. The Framingham study and other studies have shown that if you get about 12 years of education, the benefits to your brain health accrue over time such that you have a lower risk of developing dementia. To be sure, there are still PhDs, MDs, JDs, and other accomplished people who develop dementia, but overall in the population, your risk is reduced if you've enjoyed education and all the social and economic benefits that follow from that, like access to good, consistent healthcare, such as cardiovascular care. And so the message that I point out in the book is we can right now do things in our society to reduce the risk of developing dementia. We just have to muster the political will to support them. What are some other things we can do? This is my patient, Arthur Packel. I can say his name freely and openly, and his wife, Renee, because they were on the front cover of the New York Times on a story called Money Woes Can Be the Early Clue to Alzheimer's. We're all worried about how we're going to roll out the biomarkers to the disease, given their cost and expense, but there's already a biomarker out there right away, which is when Arthur Packel came to me, if you met him, you wouldn't think anything was wrong. But if you looked at his business affairs, they were in disarray. And indeed, he had made some very bad financial decisions, costing them a good deal of their wealth. Money woes were the earliest clue to his dementia. This is a result of a study that was published back last year in JAMA Internal Medicine. And it reports how at year zero there, that vertical line, in the years prior, as many as 4 or 5 years prior, there's an uptick in bad credit reports and other financial problems in individuals who have an incident diagnosis of Alzheimer's disease and related disorders in their medical record. Money woes are preceding the incident diagnosis. The point here is the financial services industry, the banks, the investment houses are literally looking at and watching failing American brains because of, as they see them through bad financial transactions, mispaid bills, fraud, abuse, rising poor credit scores, etc. Here's a way we as a society could identify older adults who are at risk of or even experiencing declining cognition and intervene on something that we all want them to preserve, not just their health, but their wealth. There are opportunities with robots. These is a variety of different robots that are made to interact with people who have cognitive impairment. There's Pepper, the talking robot. There's Paro the seal that will respond to you emotionally and make all kinds of cuddly noises and things and respond to your words. There's a lot of promise for these kind of robotic technologies. They offer great promise of doing things that humans could do but that a machine can do just as well, entertaining a person by telling them a story or otherwise interacting with them. I have a patient, for example, whose agitation is only calmed by a pet cat. The cat is not a real cat, it's a robotic cat. And she finds great joy in attempting to feed it yogurt and otherwise interacting with this cat. It's certainly safer than the antipsychotics that otherwise would have been prescribed to her, given how severe her agitation is. And yet, I do think we need to think cautiously about the use of robot technology instead of human technology to care for humans who are losing their brains, who are losing their capacity to exercise their self-determination. A robot can be just so human. They can certainly have a lot of agency. They can certainly do things and perform tasks. But do they really have the moral experience that a human has? I put a thought experiment in the book of what if Ronald Reagan had a robot? And I'll let you just go read that. You can think about some of the moral challenges of using robots to care for other humans. Okay, back to those biomarkers. As many of you may have heard, we have the ability to measure Alzheimer's disease and detect the disease, not just in someone who has dementia, but even someone who has only mild memory problems. We can even detect the disease now in someone who has no cognitive impairment. And I spend a good deal of the book talking about those discoveries and some of their implications. But what I want to focus on now is to think about that world of precision medicine for the brain. This is a bus kiosk on 12th and Market Street in Philadelphia, my hometown. And on that bus kiosk, you see here a poster that says, know your risks, know your A1C. And the image is an ambulance crashing into someone's house. There's a man in a chair and a woman in a chair. And on the side of the ambulance, it says, Hank, diabetes complications are coming to get you. So imagine a world like this. Hank, Alzheimer's disease is coming to get you. Know your risk, know your p-tau217 measure. And based on that, you get treatment to reduce your risk of getting Alzheimer's disease, dementia. That's a very attractive future, and I think one that we should be anticipating and be excited about. But it doesn't come without challenges. Here's one of them. This is an ad produced by the company Biogen. Biogen is, currently has a drug before the FDA that they would like to have licensed for the treatment of Alzheimer's disease. Targets amyloid. Here's the ad that's a part of their ads to raise awareness about the amyloid hypothesis of Alzheimer's disease. Even though he's just starting to forget where he's traveled, amyloid beta has been accumulating long before symptoms appear. So this gentleman, you can see here the amyloid beta accumulating long before symptoms appear. This gentleman rendered to look like the Phantom of the Opera. My point is that images such as these reinforce the stigmas that Walter Annenberg carried with him so that he would avoid his friend Ronald Reagan and his friend's wife and caregiver, Nancy. And I would argue that perpetuating the stigmas of Alzheimer's disease through words and images like this are not going to help us learn how to live with this disease. The consequences for this, I think, are rather substantial. This is Toni Hamilton. Toni Hamilton had Alzheimer's disease. She had mild cognitive impairment only, so she had inefficiencies in her cognition and cognitive impairment, but through biomarker tests had diagnosed Alzheimer's disease. She wasn't demented. She didn't have dementia, excuse me. She didn't have dementia, but she was on that way to that trajectory, and she knew it. And as she felt her ability to perform her daily tasks was fading, she ultimately would execute a very planned decision on her part, not an act of desperation, but a very planned decision, and she would end her life. Now, her story is rare and uncommon, I think, but I think it gestures to the problem of when you live in a world with these kind of images, you can understand why this developing dementia is so dreaded. This is Margot Bentley. Margot Bentley was a nurse, and Margot Bentley decided that she would make advanced care plans for how she should be treated. And this is a copy of her advance directive to my family, my physician, my lawyer, and others whom I may concern. And she would lay out how the kind of care she would want. And in this advance directive, among things that she specifically would detail would be, if I can't feed myself, don't feed me. And if I don't recognize my family, I ask that I be euthanized. She wrote that, signed it, etc. Years would pass, and this is Margot Bentley with advanced dementia, living in a long-term care facility. And her family would decide to implement this advance directive and ask the facility no longer feed Margot Bentley. And so the facility
implemented that order. And then it was reversed and feeding was resumed. I detail this story in the book, but the bit I'll tell you now here is the reason why they ceased following her advance directive was because they said that she had decided not to follow her advance directive anymore. She wanted to eat. And how did they know that? Because when they offered her applesauce, she ate it. And when they offered her mashed potatoes, she spit it out. And their point was she wants to eat. The story of Margot Bentley is an awful story. It became a public drama. I tell you this story because I think the stories of Margot Bentley, the stories of Tony Hamilton, are stories of us thinking about, when do we die of this disease? When are we dying of it? The prospect of having disease-slowing treatments is incredibly exciting. But the challenge that having disease-slowing treatments presents us is this. As you're beginning to decline despite treatment, and you decide enough is enough, I want to stop treatment, what then follows? What would be the palliative care that you would receive for not for the months, but the potentially years more of living with disabling cognitive impairments? Can a living will guide what that care should be? I close the book raising these points and offer some thoughts for how we should think forward about those issues. I've enjoyed my opportunity to talk to you about the book. Here's my website. And from that website, you can easily drop me a little note to talk some more. Here's my Twitter tag. If you're a Twitter person, I'm happy to sort of tweet about things and whatnot. The book's available in hardback. It's also available in ebook and also an audiobook. And I read some of the chapters. So if you've enjoyed my voice, you can hear more of it. I think we have some time for questions and I'm happy to take them. But again, I really encourage you, if you want to drop me a note, please drop me a note. I'm happy to chat some more. And I'll now ask Aubrey to see if there are any questions for me to take on.
Yes, thank you. Thank you for your time once again, Dr. Karlawish. So we've received quite a few questions kind of around the concerns of maybe older family members, their concerns about potentially getting Alzheimer's or some of those signs to look for. So to recap some of those questions that we've received, what is the difference between Alzheimer's and dementia?
Sure. Dementia describes disabling cognitive impairments. A person who previously had no cognitive impairment now is having trouble with memory, attention, concentration, multitasking, and those cognitive problems are causing disability. The person now needs someone else to help them manage their medicines, prepare a meal, travel from home to someplace else. They can certainly do some things, but things that they used to do independently, someone else has to help them. Later in the course of a dementing illness, people develop problems with things like bathing, dressing, grooming, and feeding. But early on, and for much of the disease course of a disease like Alzheimer's caused by dementia, it's those problems with daily activities like managing money, transportation, telephone. Alzheimer's disease is one of the diseases that causes dementia. It's not the only disease that causes dementia. Lewy body disease causes dementia. Robin Williams had that. Frontotemporal lobar degeneration causes dementia. Parkinson's disease in an individual over 60, 65 years of age can cause a dementia. Untreated HIV infection can lead to a dementia. Syphilis infection, ultimately, if not treated, can cause a dementia. So many different diseases, Alzheimer's is one of them, can cause disabling cognitive impairments, otherwise known as dementia.
Thank you for that. So when it comes to getting Alzheimer's or dementia, are there any activities that a person should do or avoid, or any food items that a person should either intake or avoid?
Absolutely. So again, I detail in the book how, over the last 40 years, the risk of developing dementia has been declining because we've been doing things that have kept our brains healthy. So what can you do to keep your brain healthy? Well, I've mentioned going to school for at least 12 years and having access to good, consistent healthcare, particularly cardiovascular healthcare. So let's drill down on that some more. There's good data that what keeps your heart healthy keeps your brain healthy. I highly recommend folks go to AARP's Global Council on Brain Health. It's a webpage developed by the AARP that summarizes in lay language, very well-written stuff, what you can do to maintain your brain health. And we review, I'm a member of the council, things like sleep, diet, exercise, socialization, music, and other activities. and we take stock of the evidence that either supports what's worth doing and also kind of what's not worth doing as well. Global Council on Brain Health, AARP.
Great, thank you. Are some states more favorable to advance directives that request end of life due to specific situations?
Excellent question. Some states are and some states aren't. In Wisconsin, you cannot put in your advance directive guidance around feeding. You cannot say, don't feed me under these circumstances. Why? Advance directives, they argue, are directives for medical care, and feeding is not medical care, so you can't put an advance directive about your care. In the state of Nevada, they passed recently legislation that allows an advance directive to include language around feeding a person with dementia. That's interesting because most states have reciprocity laws for advance directives. So if I have an advance directive written in Pennsylvania and go move to Wisconsin, arguably Wisconsin needs to recognize that advance directive. So we're in for a very interesting national conversation around advance directives for persons living with dementia and the kind of care they should receive or not receive.
Great, thank you. Is there a window of opportunity for new federal policies with the new administration, and how can we advocate for policies that help individuals and their caregivers?
I think there is. I think that the events of the last 12 months have shown us that we are all vulnerable. Vulnerable meaning we all either need care or need to give care. I think all of us for the last 12 months almost have been like a family living with dementia because we were isolated and separated from the world, and many of us, frankly, ill and needed help. And I do think that there's recognition that providing services and supports for family caregivers is part of the infrastructure that we need so that families can function, like roads and schools, hospitals, etc. The Biden administration's platform included proposals to improve the wages and training for formal caregivers. It included a $5,000 federal tax credit for informal caregivers. It includes some efforts also to recognize that the Medicaid demonstration project for any long-term care services and supports needs to be made a standard benefit and no longer a demonstration project. Where I think the administration hasn't made the necessary leap is, frankly, the need for a long-term care social insurance program. America, though, generally operates in increments. I think, I can imagine why that proposal wasn't put forth in a platform, given the rhetoric, frankly, from the other side around socialism. And yet, I do think maybe as a country, we've arrived at this general recognition that the system that's set up to provide long-term care services supports is simply a non-system and needs to be changed. I'm cautiously optimistic that we could arrive at the same consensus that existed up until 1988. And I detail in the book why that fell apart.
Great, thank you. So I think we have time for maybe two more quick questions. One about Alzheimer's, being that it worries. I know a few people have submitted questions saying that their parents are worried about this affecting them. Reading certain studies about lower rates of Alzheimer's among people who are bilingual. What are your thoughts on this? And also on the topic of have there been any studies looking into the connection of brain and body in conjunction with fitness?
Yeah, the brain body stuff gets back to the cardiovascular story. And I really urge you, just please, Global Council on Brain Health, there's a lot of work there on what kind of physical activities, et cetera, help the brain. The story on bilingual is probably a part and parcel of the story around education. The more a brain we think has reserve through its complicated networks, the more it can withstand pathologies in that brain. Meaning sort of, even though the pathology is there, the neurons are healthier and better connected and so better able to withstand it. It's an emerging science to explain why, but the findings are consistent. The Alzheimer's Association has 10 warning signs on its website, things to look out for when cognitive complaints should be looked into. And I would urge you to take a look at the 10 warning signs, and they help you go from, when should I be worried about a tip of the tongue problem versus something else. And I would really urge folks to take a look at those things to know when should I be worried about a relative who's having some problems.
Great, thank you. And then one last question to close out about your book, because we have a lot of people excited to and looking forward to reading your book. Is your book available on Amazon, and is it available in Spanish or any other languages?
The book is most definitely available on Amazon, Barnes & Noble, IndieBound, most local bookstores seem to have it, or they can get it very quickly. It's on ebooks. You can get it on Kindle or Nook on Barnes and Noble. It'll be available in China. Rights have not been sold yet for Spanish language, but if you contact Macmillan and say, gee, I wish there was a Spanish language version, the publisher, that might prompt them to sell the Spanish language rights for the book, so please do. But yeah, it's available in all formats, all the major distributors, as well as your local indie store. Support your local indie.
Well, thank you again, Dr. Karlawish. Thank you to Emily Arison for connecting SCAN to you to have you present for us. And a huge thank you for being willing to present for us. Is there any last minute thoughts before we close out that you have for the SCAN audience? Yeah, I want you all to have hope, especially you guys, given the work you do at SCAN. I know about what your work is. You know, we can do better as a society. We can do better as health systems. And your guys are a good example of the health systems trying to do the right thing. And I do think the events of the last year and have us woken up to the fact that we as a nation can do better, and we need to invest in this kind of critical infrastructure. So there'll be better treatments, and I hope someday as well, better care. Great. Thank you so much for your time. Everyone, have a great rest of your afternoon. If you have any questions, please feel free to reach out to me. And once again, this recording will be available as soon as it's done rendering on our SharePoint. Thank you. Have a great rest of your day. Thanks, everyone. Bye.